Hello friends, welcome to my channel. I am Dr. Himanshu Gupta, and in this video we are going to discuss the triads in surgery. So friends, you will think about all the questions. You will think the answers in your mind, and in the end we will discuss the answers to these questions. So the questions for you are: what is virtuous triad? What is virtuous triad? Where it is seen and what are its components? What is Cushing's triad, where it is seen? What is science triad? You can pause the video in between and you can think about these answers. What is science triad? It is little bit tough. Delphos triad. Delphos triad. Where is Quincke's triad? What is Butchard's triad? Butchard's triad. What is Tilloch's triad? What is Mackler's triad? Mackler's triad. What is Rigler's triad? Rigler's triad. What is Whipple's triad? Whipple's triad. What is Curarino's triad? Curarino's triad. What is Hutchinson triad? And what is Trotter's triad? Friends, now we will discuss the answers to these questions. So let us begin. The virtuous triad is seen in thrombosis, and it is associated with hypercoagulability, stasis, and endothelial injury. Endothelial injury. Cushing's triad is seen in intracranial hypertension. Intracranial hypertension. It is associated with increase in BP, bradycardia, and irregular respiration. Irregular respiration. Science triad is associated with gallstones, hiatus hernia, and colonic diverticulosis. Colonic diverticulosis. Quincke's triad. Quincke's triad. Quincke's triad is associated with hemophilia. Hemophilia. It is associated with GI hemorrhage, biliary colic, and jaundice. Biliary hemorrhage, GI hemorrhage, biliary colic, and jaundice. Butchard's triad. Butchard's triad is seen in gastric volvulus. In gastric volvulus, the patient will not be able to vomit. There will be epigastric pain, and inability to pass NG tube. Tilloch's triad is associated with mesenteric cyst. There is soft fluctuant swelling in the umbilical region. The swelling moves perpendicular to the mesentery. And there is a zone of resonance all around the swelling. Okay friends, and what is Tilloch's fracture? It is fracture of distal epiphysis of tibia. What is Mackler's triad? Mackler's triad is seen in Bohr-Avs syndrome. There is thoracic pain, vomiting, and cervical subcutaneous emphysema. Rigler's triad is seen in gallstone ileus. There is small bowel obstruction due to the gallstone. Then, due to the excessive air in the bowel gases, the air enters the bile duct, and there is ectopic gallstone. So there is small bowel obstruction, pneumobilia, and ectopic gallstone. Whipple's triad is seen in insulinoma. Insulinoma. The patient presents with symptoms of hypoglycemia. Symptoms of hypoglycemia. The serum glucose is less than 45 milligram per deciliter, and the symptoms are relieved on glucose ingestion. Galeazzi triad includes retroperitoneal fibrosis, Dupuytren's contracture, and Peyronie's disease of penis. Currarino's triad. And friends, what is Galeazzi fracture? Galeazzi fracture is fracture of distal one third of radius, and dislocation of distal radioulnar joint. Currarino triad or ASP triad. It is anorectal malformation, sacrococcygeal osseous defect, and presacral mass. Trotter's triad. It is seen in nasopharyngeal carcinoma. The mnemonic is IPC. Ipsilateral trigeminal neuralgia, palatal paralysis due to involvement of 10th nerve, and conductive hearing loss due to middle ear effusion. Hutchinson triad is in eyes there is interstitial keratitis, ear, nerve deafness, and mouth Hutchinson teeth. गांधी जी के 3 बंदर से याद रख सकते हो तुम इसको. Thank you friends for watching this video.